Good evening to all of you. Today we have a very special guest speaker with us, Honorable Kyarima Rose ma'am from Uganda, East Africa. She is a director and founder of Bhumriro Counseling Center, a professional counselor and life coach. She is doing great work for humanity, and today she is going to enlighten us with a very important and relevant topic for nowadays, that is parenting and children's mental health. It is a very important issue nowadays in our society as well as family. So, not taking too much time, I would like to invite today's guest, Honorable Man. And if anyone has any query or question, they can ask in the comment section of YouTube, where it is live right now. So, thank you so much, ma'am, once again for your valuable time. Now you can proceed.
Okay, thank you so much. Charing Barrows, that we have had, director and founder at Homuro Counseling Center, which is located in Western Uganda in Mbara City. I'm glad to be hosted today. Thank you so much. Tell our audience what is parenting. Most people thinking maybe it is guiding a child or it is telling a child what to do. So I want us to understand parenting, understand it at a deeper level. So parenting is when that climate, that environment you provide uh, for a child to grow from, or everything you do around a child is what we call parenting. So we have four types of parenting I would like us to share, and you see which type or which style you are using as you take care of the child that is under your care. One of them is what we call authoritative parenting style, or what we may call democratic parenting style. In this style, most of parents, they guide children on how to go about they set boundaries, rules, and also provide guidance. So in this style, there is also some discussion. There is also some room for dialogue between a parent or a caretaker and a child. So in this type of style, parents, they use they discipline their children, but there is always a room for negotiation. Or in this type of parenting, when a child makes a mistake, the parent can negotiate with the child which type of punishment they can do so that they can correct their mistake. So there is always a room for negotiation. And in this parenting style, parents, they set rules, set boundaries, and guide children in different fields. Then we have authoritarian parenting or disciplinary parenting. So in this parenting style, most parents also set rules and boundaries, but there is no much room for discussion. I mean, the child and the parent, they don't have much time to discuss. So there is that directiveness. A parent tells a child, you are supposed to do this and you don't need to ask me what I'm telling you. So we have seen also this type of parenting. It is also common in our society. There is high level of parental control, and also there is low level of parental responsiveness. Both authoritarian and authoritative parents, they are kind of similar, but they are somehow different. In this second type of parenting, there's no much room for discussion. And in this style of parenting, some children, they tend not to be very happy, and they become insecure. They are more hot-tempered, as we will say in our discussion. Then there is also the third type of parenting style, which we call permissive parenting. It is also common in our communities. In this parenting style, they set few rules. Even there's no much boundaries between the child and the parent. In this parenting style, there is a lot of the parent is a bit reluctant. I mean, they don't seem to be so serious in whatever they are telling the child. So there is much space. I mean, there is no boundary between a child and the parent. The child can do whatever they feel like doing. Sometimes in this style of parenting, the parent try to do everything, not to hurt emotions or the feelings of their children, and they give them a lot of freedom. I mean, the child can do whatever they feel like doing without being cautioned. And in this type of parenting, children, they can't easily follow rules. And even there is less self-control in this style of parenting by children. Um, there is the low social interaction. And even in this type of parenting, children can be egocentric sometimes. Then we are looking at the fourth type of parenting style, which we call neglect or an involved parenting style. In this style, parents, they tend to be not to be so much involved in children's life. In short, that these are parents who don't know what is happening in their children's lives. Even if they are staying with them, but they are not bothered. They don't care whether a child is well disciplined or not. They are not bothered at all. So in most cases, even the parents who use this type of parenting style, themselves, they have issues. Themselves, they could be battling with issues, either depression, or they had trauma when they are still young, or they faced some challenges when they are still children. And now, as adults, they tend not to care about children. So basically, those are four types of parenting styles we normally have in our communities. But most people may ask, what is the most effective parenting style that is good for our children and for their mental well-being? So I would recommend the first parenting style that I mentioned, that is authoritative, which is in called democratic parenting style. Because in this parenting style, there is a room for negotiation. There's a room for discussion with your child, and which is very, very important, because sometimes children have something to talk to us. They have something to tell you, despite of telling them what to do, but sometimes they have a right to suggest other ways. So it is the best parenting style for our children, and which can help the child to become less, to be at less risk of developing mental health issues. So before going into any other, before sharing any other information, and I would request the moderator if there is any other question so far, or if there is anything, or I continue. When a child suffers for a long time, or when the child falls sick for a long time, long-term illnesses. So when a child is sick for a long time, there are high chances that this child can develop mental health issues. And also, there is another factor of moving from place to place. I mean, those parents who move with children from uh, different places, when you keep changing places every day, every month, every year, it will affect that child's mental health. When a child grows from many different environments, it will affect how the child perceives things, because now they are used to this environment, now they are changed to another environment, now they are changed to another environment. They get confused. I mean, these different environments, they have different things in them. So changing environment there and then also affects our children's mental health. Even changing schools, when you keep changing a child from a school to school, it also affects their mental health, meaning they're exposed to many different factors from different environments. Then also a child being bullied at school. It also contributes towards their mental uh, challenges. When a child is bullied at school, they can be traumatized. There are some bullies, there are some methods they use in bullying these children that can leave a permanent mark in their mental health. Also, when a child witnesses domestic violence, and these are things that are common in our communities, in our households, when parents fight, when there's a lot of fighting, abuse in the home, it will put that child's mental health at stake. When a child witnesses domestic violence, there are high chances that that child will develop mental health issues. Then there is divorce and separation. Children who grow up from broken marriages, from broken relationships, they have high chances of developing mental health issues. Because if a child to grow well and to be a happy child, it's to have both parents. But here, if one of the parents is not in the picture, the child will keep thinking about it. What happened? What caused my mom and my dad separate? Who was wrong and who was right? So it gives a child a lot of questions, a lot of thinking, and it takes really, it puts a child's mental health at risk of developing mental health issues. Then also grief. When a child loses a close relative, especially a parent, a brother, a sister, they are used to, they are close to, that child is at high risk of developing mental health challenges, especially when a child loses a parent. So those children, in most cases, they fall into depression, and some of them even develop what we call PTSD. So it also takes a toll on their mental health. And also there is trauma. Some children, especially young girls, they experience rape and defilement at an early age, and as a child is growing, they develop, they suffer from that trauma. They suffer from PTSD. What happened when they are still young? It keeps in their subconscious mind. As they grow up, it comes into conscious part of the mind, and they start suffering from PTSD and all sorts of mental health challenges like anxiety disorders, panic attacks, and everything. So there are many causes uh, that cause our children to have mental health issues. Um, Before I go any further, I would request if there is anyone else so far who wish to ask, who wish to add on so far what I have said. They can really say something before I add on.
Uh, uh, Thank you so much, ma'am. Our question is come. You can see on the screen which age of children is more responsible for right parenting by the parents. Is they want to ask
Mhm.
that at which age group children needs to be, you can say, needs to be more focused by the parents regarding parenting.
Mhm.
At which age group children should be take care of.
I can say that the age group can be from 4 years and above, because the child of 4 years, they can understand when you tell them something, and when you explain to them something, they can really understand. So I would request parents to start explaining to their children at 4 years and above, to sit with their children and tell them what is bad and what is right, and what they're supposed to do. If there are some facts that can expose them to mental health challenges, it is better to explain to them, like divorce and separation. If it is single parenting, sit with your child, talk to them, tell them what happened, instead of leaving a child with unanswered questions in their mind.
Thank you so much, ma'am. We
Mm.
should move forward. Will the next questions right?
Okay. So I would like us to understand what can be done. What can we do as parents? What can we do in the community? What can you do as a caretaker of the child to prevent them from having these mental health issues? What can we do to have children who can grow up well without having risks of developing mental health issues? Of course, some of the mental issues we have mentioned them, like trauma, depression, anxiety disorders, PTSD, and also antisocial behaviors. So maybe people may think it's only depression or bipolar uh, or any other, but also antisocial behaviors are becoming rampant these days. This is when a child is not behaving in a way which the society expects them to behave. For example, stealing, use of drugs, engaging in prostitution, engaging in all other unsocial behaviors you can mention of. So what we can do as parents is to give these children more time, as in more time. Give your child a lot of time. Listen to them. Talk to them. I know some of us parents, we are so busy looking for money, maybe at workplaces, maybe we have demanding jobs, maybe we have a lot of things to do. But sparing at least 1 hour every day to speak to your child is so priceless. You can listen to what a child can tell you. Every day, our children go through a lot. I mean, they meet a lot of things. If they're at school, they see a lot of things which they would like to share with us. And sometimes we don't have time to listen to them. And the child can be at risk of developing attention deficit disorder, whereby a child, when you don't attend to them, they grow up with that emptiness within their hearts. They grow up with that gap within their heart. So when they grow up, you find them as adults seeking attention which they lacked, which they failed to get when they are still young. So I would encourage parents to have more time with our children, at least spare 1 hour every day to sit and listen to your child. Then secondly, apart from serious talks, apart from serious cautioning, apart from setting boundaries, apart from telling them ABCD, have time and pray with your children. Have time and laugh with your children. Have time and joke with your children. Oh, what's something funny and laugh together. That time is so priceless. You can bond with your child. That is the time to bond with your child. That is the time to connect with your child. That is the time to enjoy with your child. However much busy you are, the child will feel loved. You will have that connection with your child, because as counselors at our centers, at our center, we normally receive many children who are always brought by caretakers or by parents to talk to a child's counselor. So most of these children, they normally tell us that mommy or mom and dad, they don't have time for me. I mean, they don't have enough time for me. And when they come, it's only about asking your performance. You are not performing well, you are not doing ABCD. There is always that serious talk that pushes our children away from us. So they normally look at us as people who caution every time, who ask what is right and what was not done, what went wrong. We don't have time to connect with our children. So I would encourage parents that have that time. Pray with your child, even if it is a small game, even if it is just something that can connect you together. Have time and take your child. If it means take them out, take them out, sit in a certain place and connect with your child. It is very, very important. Or watch something that is good with your child, or watch a good movie with your children as you laugh together. Have time for storytelling. Tell them some stories that can stick to their minds. So that with doing that, we will really connect and work that bond with our children. And even it will give children room to disclose to us what is hurting them, even to tell us what they could be hiding. Some of these children are abused, maybe from school, maybe from the neighborhood, but sometimes they keep quiet. Why? Because we don't give them enough time to talk to us. We don't give them enough time to disclose to us what is hurting them. So one of the skills is to give these children enough time, even if you are a very, very busy person, but have that 1 hour, have that 30 minutes and talk to your child. It will give them opportunity to tell you what is bothering them. If there is anyone that try to abuse that child, she will disclose to you. She will tell you freely without fearing you. And another thing to avoid some antisocial behaviors, as parents, we need to identify what is a need and a want for our children. Yes, it is good to provide everything to your child, but identify a need from a want. Our children want many things. I mean, a child can write down the shopping list. That's what they want. But is that what they need? So as parents, we need to go back and ask ourselves, as we provide these things to our children, but do they need them? So if you are to provide everything they want, sometimes we may end up maybe cause our children to develop some disorders which we may prevent when we are doing things or when we are providing things to them. Let me give an example. When it is time for going back to school, our children normally write a lot of things they want. The list is always long. You normally separate needs from what they want. If a child writes down that I'm giving an example, I want 4 pair of school shoes, but is it really necessary to go with 4 pair of shoes at school? So what they need is shoes. So if they need shoes, yes, they can have, according to what you can provide, they can have 4 pairs, but is it really necessary? So you can choose to give them 2 pairs, and it is enough. And that's what they need to go back to school. So if, let me give also an example of the needs: school fees, scholastic materials, uniform, those are the needs. I mean, they can't do without them at school, but there are some things they can do without, and they can really study and finish without them. So those are additional things which we call wants. So most parents, most of us, we don't differentiate what is a need and a want for our children. Yes, our children want many things, but you need to give them what they need, not what they want. Before adding, let me first listen if there's anyone with a question or a comment or anything. Thank you. And which is the most important thing to do as a good parent? You need to have enough time with your children. I mean, we need to create that time. I know most parents, we are so busy. I mean, having enough time for your child is the most important thing you can do for your child. I mean, it is a therapy, even in counseling. It is a therapy. Listening to someone is a therapy. Even if you don't give them all the options, even if you don't give them all the solution, but listening to someone is the most important thing. It also applies to our children. As a good parent, try to create that time. Listen to your child. Even if they are telling you something that you feel it is not important, for them it is important. Even if you don't say anything to them, sit there, listen to them. I mean, be there to them, be there for them, having that time for them. And another tip is always have a room for discussion with a child. As you provide options, bring those options on table, discuss them with your child. If you are changing a school, for example, sit with your child, give the child some reasons why you are changing that school. So it gives It gives us a room for you and a child to come to a good conclusion. And ask a child, what went wrong in that school? What is not good? Why do you want to change school? If a child brings an option that, Dad, I want you to change me from this school to this school, ask them what could be the reason. What is not good at that school? And that child will surely tell you the reasons why they want to change that school. Room for discussion and having enough time for your children. I know some people from our audience, they are very busy parents, but even that 30 minutes giving in to your child is the therapy, is something that can make an impact on their mental health for a lifetime. And also, another tip is always move with your child. If you are going to, for example, you're going to church, don't leave your child behind. Go with them. Let them also play. Let them also see what you do. If you are doing a certain work, explain to them. If you are doing a certain job, explain to them. Don't hide things from your children. It will create a lot of questions in their head. If you're a divorced parent, if you're a single parent, explain to them what happened to avoid a lot of questions in their mind that can predispose them to mental health challenges. Thank you. Trauma, you find the child wakes up in the middle of the night screaming, having strange nightmares, meaning there's something happened that is not identified or that is not resolved. And also, all of a sudden, the child sometimes cut communications with the peers. There's that social withdrawal. A child who used to have friends, but this time the child is just alone, don't want to speak even to siblings, to brothers, to sisters. They just want to be themselves, and they just want to be alone. They don't want to talk to someone else. And also some children, they tend to say that I'm feeling pain, maybe abdominal pain, maybe some pain which cannot easily be identified, meaning that child is having psychological pain. They may need to be listened to. A child who's always feeling annoyed, feeling irritable, easily irritable, something small they overreact, or something small they just cry. So you know that that child could be having mental health issues. And also, there are some children who develop what we call somatoform disorders, who just from nowhere start fainting, start collapsing, without any clear explanation, without any clear diagnosis of what is causing the fainting or collapsing. That child could be having mental health issues, which it need to be identified and worked on. And also, a child can develop excessive fear. They start fearing some small things. They have anxiety disorders, and even sometimes they develop panic attacks. They will tell you something is chasing them, or they tell you there's something that is running after them. When you go to the darkness, they will start telling you that they are hearing voices, or such kind of things, or they will tell you they are hearing commanding voices. So those are signs and symptoms of mental health issues. Also, poor concentration. If it is at school, a child who is to concentrate at school in class, by this time they don't mind whether they perform well or whether they go to another class, they no longer mind. They even lose interest in things they used to like. If a child used to like football, by this time they don't care. So meaning that child could be battling with mental health issues, and we need to pay attention to them and help them out to identify what is bothering this child. Even we have people who studied children's psychology, who can sit with a child and identify what is bothering them. So it is very important not to ignore these signs, however much they may seem small to you, but it can be carrying a very big magnitude on your children's mental health. So it is good to pay attention, extra attention, to children, how they behave, how they conduct themselves, and everything around them, so that we don't sit on something that is not clearly identified or under diagnosed.
It is very important and essential thing Honorable Ma'am told to everyone, whether they are parents, they are psychologists, or they are common people, they should keep or they should observe and watch these signs and symptoms very sincerely in their child, in their surroundings. So without being late, they have to take proper actions regarding it. It is very essential and very important thing, ma'am.
Mm.
Another thing, when we talk about the mental health professionals, whether, as you mentioned, they are psychologists, clinical psychologists, or psychiatrists, so what they should keep in their mind, or especially when they take a case related to children, so what will be the points should be take care of by mental health professional while dealing with these children issues? So what is your advice to the mental health professionals?
Advice to mental health professionals is that children, they are the most important population in this community, because this is our future. If you don't treat the child well, meaning there's no future. So, and also if you don't help a child at an early age, they will become maybe useless adults. So that's why we need to pay extra attention to children, actually more than adults, because this child, if this child is not well diagnosed, if this child is not well helped, they may grow up with that trauma. And when they grow up with trauma, they become confused adults. If a child is bullied and it is not resolved and it is not helped, this is the person in the future who will end up beating his wife, or this is a child in the future who will become a drunkard or drug addict if they are not helped. So that's why I normally tell all mental health professionals that children, they are most delicate people, and we need to pay extra attention to them because they will turn out to be adults. And if you don't help this child overcome what they are going through, meaning it is going to affect their adulthood, because our personalities and our character is always shaped by our childhood environment, is always shaped by our childhood experiences. If you find an adult who's violent, who's addicted to drugs, who's doing all sorts of bad things, you need to caution their childhood. You need to go back and dig out what happened when they are still young, what happened around their childhood, what they went through when they are children. So that's why children, they are most precious thing we can do, and we need to handle them with a lot of care. I mean, we need to pay extra attention to them. Even if the symptom is mild, please sit down and resolve that issue. Which can, because in the future it can develop into a serious mental health issue. Yes.
Thank you so much, ma'am. It is very important thing, not only for your country, ma'am, and it is also applied in India, also in Uganda, also all over the world, because the youth, the children are the foundations of a nation and a society. So, as you mentioned, we should take a proper care of their holistic health, especially mental health, in which situation, in which environment they grow, it leave a great impact on their whole life. So a parent is mostly responsible for a children's life, and for a better society, for a better nation. We should take care of these issues, especially related to children. Ma'am has told very insightfully about this topic, parenting and their children's mental health. So I think right now we are not some more questions, ma'am. Is there anything left from your side? You can proceed in this topic, or otherwise we will move to the next section of this session.
Okay. Thank you so much. I would also tell parents who are watching us this show, who are watching this talk show, that our children can't be in our lives forever. Prepare a child in a way that when they grow up, they become independent. Let us be in our children's life as if we are going to be with them forever. So let us prepare them in a way that they can be independent, in a way that they can make their own informed decisions, in a way that they can live as responsible adults when we are no longer there. Let us prepare our children to conduct themselves in a way that when we are not watching them, someone can look at them and look at them as, no, this is a responsible person. Even if they are still young, create that room for autonomy, create that room to be, the child to be independent. I mean, don't do everything for them, especially a child of 5 years and above, 8 years and above. They can do, at least they can decide on some of the things. So let us not make all the decision upon our children. At least give them a room for discussion. It gives them that sense of maturity. It gives them that sense that they can also decide on something as we keep guiding them. Yeah.
Thank you so much, ma'am. And before winding up the session, audience should know that ma'am is doing a great work for humanity. So I got few pictures from the work of ma'am. So I would like to present on the screen, and I will request ma'am to kindly tell few things about these pictures. So also me and other audience will also be enlightened with your work. So here, ma'am, we are going to present some pictures related to your work, related to your center. So kindly guide us more about these pictures.
Thank you.
So here is the first picture. I think it is related to your center and what are the services provided by you. It is mentioned here. So kindly tell me more
Yeah.
about your center. And also there is a line in your logo that I think every life matters. Yeah, I think
Yes.
yes. So, how you choose this as a tagline, and what is the importance, and why this idea came into your mind to mention this line in the logo?
Yes, thank you. As you can see in the picture, it is Uhumuro Counseling Center in partnership with Steps Recovery. Steps Recovery is our medical arm that give medical treatment to people who are battling with addiction, especially those who are battling with drug use disorder. So every life matters. It means every person is important in our life. Every person you meet every day is important. Even if someone may look less important to you, but that person is important to someone else. So every life matters. So in community, there are some people who take other people for granted, but every life matters. Even if it is a child, even if it is an old person, every life matters. That's how that slogan came about. Yeah, so even the flyer shows some of the services we offer. We also help people who are battling with addiction or who are battling with drug abuse. We help them. We also give all types of counseling services as they are highlighted in the flyer: marriage counseling, stress and depression, child counseling, mentorship, life coaching, as you can see them in the flyer. Yeah.
Thank you so much, ma'am. And here is the next picture on the
Mhm.
screen. Kindly tell me about this work or this campaign. What
Yes,
is
thank you thank you so much. This is when we had women at our center. So we are equipping them with life skills because we normally receive a lot of clients who are female, who are women, who are seeking for counseling, especially marriage counseling, battling with financial challenges. So there is one of our partners, which is Empathy Project. It is a research-based organization which do research and mental health, especially among women. So they supported us to equip these women with life skills. So you can see we taught them how to make doormats, how to make artificial flowers, how to do knitting and tailoring. These are the things which they can do and they sell to get some money at home so that it can reduce on the domestic violence, on the misunderstandings in the home that are caused by lack of finances. Yeah. Yes, in this picture, I was giving a mental health talk in Tungamo district in Western Uganda, where we are called to give mental health and psychosocial services to people. It was a mental health camp, and Humro Counseling Center was invited to provide free counseling services to the people. But before giving counseling services, I first gave them a mental health talk. Causes of depression, signs and symptoms of depression, anger management skills. Yeah, that's what I was doing in that picture. Here we were at a secondary school, also in Ntungamo district, where we had gone to speak to students about addiction. We had gone there to give them a talk about substance use disorder and addiction and how they can avoid and how they can tell someone moving into addiction direction, and those who are already there, how can they be helped and how they can quit. Yes, here it was also a camp. We had gone somewhere to give psychosocial services. It was also in Ntungamo, where they are providing free counseling services to people.
Thank you so much, ma'am, for your great work for humanity, providing free counseling in your country and guiding the people, or we can say all age groups, for a better and divine life, a life of full of mental health and good psychological well-being. So thank you so much, ma'am, once again
Mm.
for your today's session, providing your valuable time, enlightening enlightening everyone on a various serious and important issue, that is parenting and children's mental health. It is really a very sensitive topic you have touched today. I hope so. Everyone, especially parents, will listen it and try to adopt the things, the valuable points suggested by you in their parenting, and so that they can adopt a good parenting style for the better future of their children. So thank you so much, ma'am, once again. Before winding up the session, what will be your conclude remark during this session to every parents, we can say children, to everyone, or we can say whole humanity? So what will be your conclude remark at the end of today's session? What will be your
Thank
message?
Thank you so much. My concluding remarks is that as parents, we also have our own issues. Sometimes we find parents battling with depression, with poor anger management skills, and also with an unresolved trauma. Let us also, as parents, seek help before displacing anger towards our children. Because if a parent have issues, have unresolved issues, mental health challenge issues, you are going to displace anger to the innocent children. You are going to be easily irritable. You are not going to provide good environment for a child to grow up from. Meaning you as a parent, meaning me as a parent, if I don't seek help to resolve what is bothering me, I won't be providing a good environment for my child. And also as a parent, let us be good examples. Because parents, we are blackboards where our children learn everything from. Most children learn some things from observation. They observe and learn what you do. Exactly, that's what they will do. So let us take ourselves before we criticize how our children are behaving badly. We as parents, let us check ourselves. If we have depression, if you have poor anger management issues, if you have stress, seek help. Seek help so that you can be a better parent for your child.
A very inspired message by ma'am. I think every parent should keep in their mind and lives, try to adopt it. So thank you
Mm.
so much, ma'am, once again. And I think we should conclude or we should wind up today's session with your permission.
Yes. Bye.